presentation for the cardiology patient, and then we will move to our showroom to take a look at it and return to the presentation to see the other auscultation models for pulmonary, which we will be seeing the models. Okay, so let's check the presentation. Just please give me a second. We're gonna start with the cardiology patient K. Okay. And well, this is the version 2, because there was a long time ago, the very first model we developed for cardiology examination, but this is the second version that is being promoted, and K is, in very simple and rough terms, is a cardiology patient simulator, and a whole cardiology patient simulator, and because of that, it is useful in many areas of healthcare education, not only for medicine or medical students, but also for nurses, of course, and also professionals in healthcare education, which are dedicated to research about finding new teaching ways. They also use this model to make their papers, their research. So this is a model widely used in many areas. And because of that, nowadays it's being used in more than 500 facilities all around the world, not only in Japan, but in many places. This model is being used right now. And the features, to explain them very easily, because they are a lot, we will split it in two. First, the training skills, and then the way of operating the model. So training skills, and then the easy control. These are the two parts we will be looking at. So let's start with the training skills. First of all, we have all these cases that you are seeing here in the screen. 36 cases, sounds, and 52 cases of arrhythmia and ECG simulator. So all in total, we have, as you can see, 88 different cases. So this makes this model one of the models with best variety of sounds. But here, there is something very important to clarify. All the sounds that we included here in this simulator are real sounds. All of them were recorded from real patients, and that's why they are not like simulated sounds. Actually, they are real sounds recorded inside the computer of the simulator. So maybe you can find in many other places simulators that offer you hundreds of different sounds, but most of those models actually have only simulated sounds made by computer and are not real sounds. And that's a huge difference, because since this part of auscultation is very difficult, because the sounds are in a very subtle and very specific way, it is extremely important to have real sounds, not simulated sounds. So please kindly make an emphasis and stressing this point when you explain this product to your customers. And regarding the areas to make the auscultation, as you can see in this slide, we have included the auscultation areas in the anatomical accurate places, which are these that we are seeing here. The first is the aortic area, this one, and then the pulmonic area, the tricuspid area, and the mitral area. Sorry, this should be here because for some reason it went down, but there are these 4 different areas to auscultate. And actually, these are the places in which the speakers are inserted inside the mannequin body. And this has also a very important reason. Unlike other simulators in the market, this model doesn't work with sensors. There is no sensors in this simulator, only speakers. And the reason is because with a speaker, we managed to reproduce the sound spreading all over the thorax in the same way that it does in the human body. And that cannot be done with a simulator that works with sensors. So this is also one very important feature. The spread of the sounds is realistic. And besides the heart sounds, we have, of course, the respiratory sounds on the back, because when you make an auscultation, of course, you are able to hear a little bit the breath sounds as well with the heart sounds together. So that's why in these 3 areas, we have included also speakers to hear the respiratory sounds. Only they are the normal cases. You cannot hear pathologies here because, you know, the main subject of the simulator is cardiology. That's why only normal breath sounds are included. But as we explained, this is not an auscultation simulator. And because of that, we have included the palpation part of the examination, which consists in palpating the arteries in different places in the body. For example, the carotid artery right here in the neck, or the branchial artery right here in the arm, or the radial artery here in the wrist, and of course the femoral arteries right here. So you can palpate all those pulses in all those places. And the point here is that those pulses, of course, are synchronized with the cardiology sounds, with the heart sounds, and with the heart rate, of course, so that the students can take as a reference point the pulse to, understand the sounds that they are hearing with their stethoscope. So actually, heart sounds and pulse are things that go together. And if the students are not able to understand both of them at the same time, there is not a real learning about what is going on inside the heart. So all those simulators that are not able to palpate the pulse, they are not really providing a good understanding about a heart examination. So this is also a very important point. Sound and pulse together to hear and feel with the palpation. And here we have other things that you can palpate that are called like right ventricular lifting or left ventricular heaving or left ventricular enlargement. They are these 3 points right here that they are kind of, just to give you an image about it, it's actually the heart, the left side of the heart just hitting a little bit the thorax, the ribs. And that small hit, it causes a lift right here in this part. And also it is palpable. So we also included these 3 palpation points. And additionally, also, there's an option to recreate the abdominal respiration movement up and down right here, just to make more realistic the simulation. And finally, we already saw the auscultation part, the palpation part, but also the inspection with the eyes is a part of the examination. And this is performed looking at the jugular veins right here, which also have a pulse, and that movement is visible with a small lamp, as here in the picture. And in order to provide a better understanding about all these things that students are hearing, palpating, and seeing, there is an option showing the electrocardiogram and sphygmomograph that it gives you the graphics on real time, which are synchronized with the sounds and pulse. Everything is synchronized, and you can visualize here the pulses, the beats in real time in order to understand the complete cardiac cycle. This is the objective of the simulator, that with all this information, the students can understand the cardiac cycle and understand if there is a failure in any part of this cycle. And also we have here the visualization of the sounds as well, in the same way as the electrocardiogram. For example, here we have 2 different patterns, the S3 gallop and the S4 gallop. And this way the students can see the difference in a very visual way, more easy to understand. And here there is also one more point to emphasize, and that is you can use your own stethoscope. There is no simulated stethoscope. This model allows the practice with a real stethoscope, which is also very important. There are many models in the market with just simulated stethoscope, but those are not very real. Here we have a picture comparing the systems of these 2 technologies. I mean, the speaker technology that we explained before and our simulator has, and the other sensor technology that many others have. And as you can see here, the speakers are spreading the sound naturally. And if you see at the sensor simulator, well, there is no speaker. Actually, the sound in most of the cases come from the stethoscope. And because of that, there is no spreading of the sound. So if the students put the stethoscope a little bit far from the auscultation area, they just will not get any sound. But actually, that doesn't happen in the real human body. If you just put a little bit far from the auscultation area, your stethoscope, you will get a sound, a little bit smaller, maybe, degraded by the distance, but still a sound. And our model can provide that, but the others with sensors cannot provide that. And why it is so important to train with a real stethoscope? Well, this is because in the real clinic day-to-day, the students will, or the doctors will use a real one, and they will also be able to learn those very small differences between one auscultation point and another. And also, if you have a speaker, this allows you to get more students practicing at the same time. So this is also a technical or logistic benefit that the simulator provides for the teachers to get more students practicing in less time. So we have included all these looking for educational goals that help the doctors to make the teachers to make their work easier. So all these things that we just saw, the sounds, the pulses, the palpation of the chest, also the information given in the screen, all this is related and integrated so that at the end of the day, the practitioners become able or capable to make diagnosis, to link all the information that they get from their senses, to integrate them and finally make a diagnosis. And also, well, this is how the electrocardiogram screen looks like. It also shows any other important information as the heart rate or the blood pressure or respiratory rate, and also the temperature. So with this, our aim is that the students become able to coordinate their eye or sense of touch and ear and all their 5 senses to learn how to identify cardiac problems. So these were the training skills or the learning features. But now let's take a look at the operational features. The first one is that the model has a wireless remote control. It will consist of a wireless tablet, very easy to operate, and allows to the teachers to just change very easily all the cases as we are looking at right now in real time, so that they can just keep the session going without interruptions. Also, this tablet can operate 5 different units with different cases in each one. This means you don't need to put the same case for all the 5 units. You can put a different case in each one and change them anytime. And well, here we have a drawing showing that I just mentioned. For the unit A, you can maybe set aortic regurgitation, and for the B, any other like mitral stenosis. So each one you can put a different case, and this is useful for exams and also for groups training with different cases. So this gives the instructors the possibility of making scenarios involving several patients in one setting, for example, or also include in one session different students with different levels of specialty or capability, and also just to make different personal presets for very particular academical purposes. Also, one more feature is the playlist maker. Since the teachers usually make one and over the same practice, well, they don't need it, to keep changing all the time the same cases that they always use. They can make a playlist and save it in the tablet so that they just play it with their students, and then the cases will run automatically and will change automatically with the time assigned right here. So you can choose the case and the order of the cases and the duration of the cases. You can choose up to 10 different cases from the 88. And well, here it's more or less it's the same operation. Here we have the sound 1, the split, and 10 minutes of duration. And then here we have a ventricular premature contraction for 5 minutes. And this is the way we can choose and make a playlist. So with this, we have standardized lessons among educators or students with different levels. You can make a playlist for undergraduate students and one more different playlist for residents and one more for other purposes like OSCE, for example. So this really makes easier the work of the teachers. It's very useful for them. Not only is good for the students, but also for the instructors. So with this, we can save time and the practices, and also make scenario-based training very specific for each level of specialty. And also, well, the teachers can just modify their sessions when it's necessary. And as additional comment about the operation of the model, we have included an error indicator system that it's at the beginning of the operation of the model. The system makes a brief scan about the most important parts of simulator as connection of the the pulses or the connection of the speakers, so that if there is something wrong, the system will advise you automatically, so that you can well know what is going wrong, and you will get this here like an error code that having it, you can just call us and give us this code, and we will have an idea about what is the problem of the simulator. So this, we hope you don't need to use this, but in case, well, it's very useful troubleshooting system. It also saves time for our customers and us, and it's very easy to use. Also, we have a large monitor for big group sessions and a smart connection, and smooth mobility. Since it's all in one unit, you can just change it from one room to another, and it's very easy to transport. And of course, there are many models now in the market, but there is one that also it's been promoted these days. We have heard about Harvey, it was developed by Miami University, and is, I think, is right now promoted by Lsat. And we have here some differences. The first one is the hard sounds, in which in our model are realistic or real, totally real. And the previous versions of Harvey used to be simulated. I'm not sure if the newest version is simulated or real, but in the previous one, it was not. Also, the stethoscope in ours, it's real. Well, in the previous versions of them, it wasn't. We would need to check what is the case right now. And talking about the number of cases, we have 88 cases, and they have only 50. So with these three, already we have a big difference in terms of learning. And also the other operational features, well, we have an external speaker to show the students the sounds before they auscultate them. We have a big monitor, we have the wireless tablet and the playlist, and these are features that they don't have. Also, well, this simultaneous operation of the units, we have 5, they only can operate 1. And well, they have a microphone, but we don't consider that that's really important. So they have some abnormal respiratory sounds as well, but we think that that's not really necessary for this cardiology patient. And also the blood pressure measurement, that we don't have it and they do, but also we don't think is really important. So because of this, the model has been used in Japan for many years, since we launched the very first version that you can see here in these pictures, until, well, nowadays with the new one. And the market for this model is, of course, medical, at the schools on the left, for medical students or nursing students, but also in hospitals, just to train doctors which want to specialize in cardiology, the specialty of cardiology, and nurses and of course, medical interns and residents. So these are the potential customers. As you can see, it can be used everywhere or sold everywhere. And here we found a very recent paper from university. They they made a comparison between some students of the third year, which used the patient K, and some other that they didn't use the patient K, and then they compared their performance. And as you can see here, we have different cases that they gave to the students to hear: aortic stenosis, or diagnosis or representation, or mitral regurgitation, and sound wide split. And you can see that here in the left, we have the people that didn't use the simulator, and on the right, we have the people that really did use our simulator. So as you can see, the ones that used the simulator, they got more correct answers. 38 against 49, or 35 against 51, or 35, 52. So as you can see, there is a big difference between the students that used the simulator and the ones that didn't. So because all these reasons also, well, this model actually was developed with the orientation of the Japan College of Cardiology, and because of that, it's being used in many of their seminars in which we usually participate here in Japan. Like, for example, these are the contents of that seminar: the basics of cardiology examinations, and or also case conferences of many case studies showing how this model is useful. And we have many references in many papers because this model is really famous, as we already mentioned, and it's used also in the research field for new academical methods and new learning techniques. So it is very useful as research. So this is why, well, it's very recognized, as you can see here in the picture of this annual scientific session of the Japanese College of Cardiology. And well, this is why this model is very useful. Thank you very much for the waiting time. So this is our patient K2, our simulator we just talked about. And as you can see, it's all-in-one unit containing the torso, the mannequin, the monitor showing all the clinical data, and here we have the tablet, the control tablet. So with this, we have an all-in-one unit, and it is very easy to use. First of all, please let me get a little bit closer the camera. So here we have the monitor with all the clinical data. And as you can see here, we have the tablet with the different cases right now. So just with one touch, you can change the case. And all the electrocardiogram graphics are going on.
accordingly. Everything is synchronized. And with this, you can just select by one touch whatever you want to hear. So it's just as easy as this. And also, the teachers can, as we mentioned, show these sounds with the external speaker, just like one touch like this. So this is the sound that is going on inside the thorax and what the students can hear with their stethoscope. And this way, the professor, the teacher shows to everybody how is the sound, and then they start auscultating with their stethoscope. Also, this tablet allows just to hide the information if we want. If we don't want to show the monitor, if we don't want to give any information to the students so that they just give their answers based on what they hear, well, we can hide all the data with one touch or show it again. Also, we can hide all these things just by one touch or putting them back again. This is according to the purposes of the teacher, what they want to show to the students or not. And also, here we can change the heart rate, just sliding this bar very easily, and it will be immediately reflected. We cannot measure the blood pressure, but we can just set it up as a clinical data so that the students can consider it. And also, we have here an open book icon that gives us a very brief explanation about the sound that we are looking at. So it's very easy to use. And with all these operations, well, the students just can, perform their examination. They can use a real stethoscope like this and just start like palpating the pulse and at the same time taking all the sounds, auscultating them. So this is the way in which the model is used.